you know that IVO is already approved and either alone in relapse refractory patients, frontline in frail patients, but the AGILE study compared IVO plus 5-AZA to 5-AZA plus placebo. So the trial is positive again. We triple the duration of overall survival. It's 24 months in the context. And the first question was to evaluate clearance of commutations while patients are on treatment. And the second objective of the study was to examine mutations emerging on treatment and leading to relapse. So among 146 patients, 72 received IVO plus AZA. And among these patients, we had molecular data for 46. So what happened? Among patients who achieve clearance of all baseline mutations, I don't like clearance, meaning we do not detect because most of them remain present if you take another techniques, but roughly 2/3 of CR/CRh patients may see the disappearance with the techniques we are using of all the mutations, including IDH1, of course, but NRAS, BCOR, STAC2, SRSF2, RUNX1, and PM1, U2F1, DNMT3A, and A6L1. So the other important information are emerging mutations during treatment. So among the 46 patients, 22 were identified as having emergence of mutations. So 22 among 46. And among these 22, 7 had achieved the CR and cleared all baseline commutations. That's important to note. But among these 7, only 1 subject relapsed at this time. So you may see a reappearance, dependent on the technique and clonal evolution, of mutations that may not be detected at CR. The other important point is we haven't seen at relapse no second site mutations, as previously described in relapse refractory IDH1 patients with IVO. This is frontline, and only 2 patients had emerging mutations. Among the patients who relapsed, 6 of 8 patients at time of relapse had new mutations, including different types of mutations, A6L1, TP53, FLT3, TKD, FLT3-ATD, KRAS, NRAS, and RUNX1. So in total, IVO plus AZA leads to deep and durable responses associated with clearance of mutant IDH1 clones and baseline commutations in 73% of the patients who achieved CR, and also clearance of all baseline mutations, which is fairly new. The other thing is at relapse, we haven't seen, this is a small cohort indeed, mutations in IDH1, no second site mutations were seen. Among the 8 patients who relapsed in the subfraction studies, mutation in the IDH1 was only seen in 2 out of 8 patients, suggesting that it's independent of IDH1. And recurrence of mutations or recurrently seen mutations include A6L1, FLT3, RUNX1, and TET2.